I would like to talk about what may be a significant advance in the treatment of peripheral neuropathy. Before I get into what that is, I would like to clarify some terms because it gets a little confusing. The main point of confusion is peripheral neuropathy versus peripheral nerve injury. So peripheral means far away from the central part of the body, generally the arms and legs. Neuro means nerve, pathy means a problem. So peripheral neuropathy usually means numbness or tingling, perhaps even weakness or burning in the areas of the, most commonly in the feet, the ankles, the lower legs, and also perhaps in the hands or those areas. So this is usually what we call idiopathic, meaning we don't know what causes it, although it is associated with disorders, for example, such as diabetes, where it is assumed that it comes because of the problems with the blood vessels, small blood vessels to the nerves. This is different from peripheral nerve injury, which is usually traumatic or the result of constriction. For example, we had a patient who had damage from lack of blood flow to the nerves to his lower legs from an operation on the artery in the leg. This is generally fairly straightforward to treat. We're not always successful, but often by injecting into the area of the nerves and blood vessels, people get better. One remarkable patient, for example, 24 years after the aforementioned operation, continually had numbness, skin changes, and some weakness of his legs. By injecting around the nerves and the blood vessels in the lower legs, we were able to restore sensation almost fully and a significant amount of strength. We have had similar results, for example, in nerves in the face. Trigeminal neuralgia has responded to injecting around the trigeminal nerve. Even ED is a nerve problem, and injecting into that area locally produces success in a significant number of people. But again, this is different from peripheral neuropathy, where there really is no injury that we know of, but people just get numbness, tingling, burning, lack of sensation, and sometimes weakness. This has really defied successful treatment. In general, injecting around the nerves in the area really hasn't been successful, and it's something that we haven't done for that reason much. However, we have reason now to think that peripheral neuropathy may well be, at least in some cases, coming from the brain. We had a couple of patients where this clearly seemed to be the case, and have treated two patients using exosomes directed toward the brain rather than injecting into the local areas. The first patient did not have benefit, but the second patient did. It's fairly early, but had definite improvement in sensation and feeling in the area where it had been absent for literally decades. We're going to be treating further. At this point, we don't know if this is a one-off or represents a whole new treatment approach. We actually have reason to think from a couple other patients that at least in many cases, this is going to bear fruit. Treatment is simple. We are enrolling patients in a clinical trial now for this at this point at no charge, and we'll see where it goes. But it's an exciting development in an area that tens of millions, probably hundreds of millions of people worldwide suffer from, and for which there hasn't been much treatment. Some medications have been helpful. For example, gabapentin can reduce some of the burning, although, and actually the patient that I described who did get better was taking gabapentin and didn't really like taking it because it can have some cognitive effects. So there are some medicines that can mitigate the symptoms, but there really hasn't been anything of which we're aware that has seemed to, in a significant way, actually reverse the disorder. So we think that we may be on the threshold of this. We're going to continue to treat, and time will tell. I will report back later with updates to let you know whether this is an area with great promise and success, or maybe it's just something for the occasional patient.